Hoarding is a complex psychological disorder that affects millions of people worldwide. It's characterized by difficulty discarding possessions and excessive acquisition of items, often leading to cluttered living spaces that interfere with daily life. If you know someone struggling with hoarding, you might be wondering how to help. This video will guide you through the process of supporting a hoarder with compassion and effectiveness. First, it's crucial to understand the hoarder's perspective. Hoarding is not about being messy or lazy. For many, their possessions represent security, memories, or potential future use. Approach the situation with empathy and avoid judgment. For example, I know someone in their 80s who hasn't worked for more than a decade and still holds on to items needed in their career. Remember, the items that seem worthless to you might hold significant emotional value for the hoarder. For example, I know a person who may find a 20-year-old newspaper with a phone number and name on it. It brings back memories which they feel they can't part with. When helping a hoarder, start by building trust. Open a dialogue about their living situation without criticism. It's difficult at times to deal with them because in starting the process of cleaning, every item picked up may have a story attached to it. As a result, the individual wants to talk about it and will not want to discard it. As a result, we are working at a snail's pace. This can be extremely frustrating for those who want to help, and forcing a speed up to the process will not help. Express your concerns for their safety and well-being. Offer support and reassurance that you're there to help, not to take control. Control is a huge issue. If the individual senses that someone else is trying to control the process, it will end in failure, an argument, or worse. This foundation of trust is essential for any progress to occur. Next, work with the hoarder to set realistic goals. Start small and focus on one area at a time. This could be clearing a pathway through a room or organizing a small corner. Celebrate these small victories to build confidence and momentum. Remember, progress may be slow, and that's okay. Encourage the hoarder to make decisions about their possessions. Avoid making decisions for them, as this can cause distress and resistance. Instead, ask questions that help them evaluate the usefulness and emotional value of items. For example, when was the last time you used this? Or how would you feel if this item wasn't here? It's important to recognize when professional help is needed. A mental health professional specializing in hoarding disorder can provide valuable strategies and support. Of course, if you can find a good mental health professional, it could be a very expensive proposition because the timeline to, say, clean up an entire house could take many, many months. Possibly it could take years. Professionals can address the underlying issues driving the hoarding behavior and offer cognitive behavioral therapy techniques. Consider involving a professional organizer experienced in working with hoarders. They can provide practical solutions for decluttering and organizing while being sensitive to the hoarder's emotional needs. Throughout the process, be patient and maintain boundaries. Helping a hoarder is often a long-term commitment. Set realistic expectations for yourself and the hoarder. Take breaks when needed to avoid burnout. After initial progress, focus on maintaining the decluttered spaces. I have actually tried moving a hoarder to another environment, and in a few months the new environment looks just like the old. Help establish new habits and routines to prevent the return of clutter. This might include regular check-ins, continued therapy, or support group participation. But the big problem is the desire and commitment of the hoarder. Remember, helping a hoarder requires patience, understanding, and often professional support. It's a journey that takes time, but with compassion and the right approach, you can make a significant positive impact on a hoarder's life. By offering support, encouraging professional help, and maintaining patience, you can help a hoarder reclaim their living space and improve their quality of life. But unless the individual feels the need to change, nothing will change. It's one of the most difficult illnesses to cure, worse than cancer in my opinion. You have a loved one who is living in abominable conditions and feel you can do nothing to help. My advice is to be calm, non-judgmental, and hope and pray for little successes along the way.